A recent study found that medical problems contributed to 62% of all bankruptcies in 2007, and that between 2001 and 2007, the proportion of all bankruptcies attributable to medical problems rose by nearly 50%. And interestingly, 78% of those who experienced bankruptcy as a result of illness were insured. They were insured. This is not people who did not have any health insurance, but it speaks to the inadequacy and the lack of coverage, comprehensive coverage, in many health insurance programs. Mr. President, we really, as a Congress, for whatever reason, and I'll suggest the reason in a moment, don't really spend a lot of time really discussing why the American healthcare system is so expensive, why it is so inefficient, why it is so complicated. We don't talk about that very much. And I fear that that has a lot to do with the role that private health insurance have and play over the political process in this country. So let me be very clear. In my view, the evidence is overwhelming that the function of a private health insurance company is not to provide health care. The function of a private health insurance company is to make as much money as it possibly can. And the truth is, the more health care a private health insurance company denies people, the more money it makes. So if you submit a claim for coverage and they deny it, from their perspective, that is a very good thing because they make more money. Further, in pursuit of making as much money as they can, private health insurance companies have created a patchwork system, which is the most complicated, the most bureaucratic, and the most wasteful in the world. And according to a number of studies, we are wasting about $400 billion a year in administrative costs, in profiteering, and in bureaucratic billing practices, and that is enough money to provide health care to all of the uninsured. Now, I know that that's not an issue we're supposed to be talking about here on the floor of the Senate, because we're not supposed to take on the insurance companies or the drug companies because of all of their power. But I think if we are serious about moving toward a universal, comprehensive, cost-effective healthcare system in this country, we have got to talk about the very negative role that private health insurance companies are playing in that process.